Hi, my name is Nicholas Seifert, and today I will be talking about a U.S. policy that I would like to see changed in our legislation. Gay and bi men in 2020 make up 82% of HIV transmissions in the U.S., according to the CDC, or Center for Disease Control. And because of this, must refrain from having sex for 3 months in order to even be considered for giving blood that is so desperately needed in the U.S. In this speech, I will explain the law preventing men who have sex with men from giving blood and why it's an outdated mindset that is not relevant in our current society, as well as a plan that would hopefully push policymakers to repeal this discriminatory law. The whole 3-month deferral period that would allow gay men to give blood basically prevents men from having sexual contact with other men under the guise that gay men have a higher chance of contracting HIV due to lingering ideas from the 1970s and 80s during the US AIDS pandemic. This whole policy itself paints LGBTQ men in a poor light as it stigmatizes these people as the face of a sexually transmitted disease, or HIV. Every person is capable of contracting this disease, and if they are so worried about the transmission of HIV, then everyone who wants to donate blood should have to go through these unrealistic guidelines of not having sexual contact with one another for 3 months. The whole reason this is not changed is explained perfectly by the American Public Health Association's quote, "It is not based in science, but it appears to be modeled after other countries' choices and fears," found on gladnationbuilder.com. The policy that prevents men who have sexual contact with other men from participating in blood donations using a 3-month deferral of sexual contact with other men should be repealed. My plan would hopefully change this law through the use of social media platforms in order to spread the word about this changeable law, in order to get traction, in order to enact a boycott of blood donations in the US. This would force policymakers and make them have no choice but to change the law, because if this plan was enacted, the US would lack a lot of blood supply and a lot of emergency care would come to a stop and be put on hold. This would cause many preventable deaths just because of a discriminatory and homophobic law. The whole argument that the deferral is just precautionary and due to the statistic that gay men have a high chance of contracting the virus is null and void when you realize that all blood donated, no matter who it is from, is screened and tested. And no matter if someone's blood is quote-unquote gay or quote-unquote straight, according to US policymakers, there's still a chance that the tests fail and HIV is not screened in those tests, because the disease doesn't choose based on if you're gay or straight. It is unbiased. Even though the American Red Cross spoke out against this by saying blood eligibility should not be determined by sexual orientation. Now, why does all this matter? It's not like it truly affects men, gay men. They just can't give blood, right? Big deal. Wrong. With this stigma that HIV is a gay man's disease and not a disease that affects everyone, it is wrong, because the disease doesn't care who you are or your sexual orientation. Gay men get discriminated against for this stigma in the health field and just on the street because of the negative stigma it holds as people being dirty or unclean, and that's why it's important, because it stigmatizes these people in a negative light when the disease is unbiased and affects everyone and they can't help but when it gets contracted. Pushing social equality issues aside for a second and just speaking objectively, the US is in a severe shortage of blood, and that is a need for critical care. And the quarantine has only made this problem worse due to blood drive cancellations. There is blood in short supply as the drives done by the American Red Cross, who make up 40% of the US blood supply, according to NPR, or National Public Radio, have been canceled. According to National Public Radio on March 17, 2020, have been canceled, which is why now is the time to not be picky when it comes to who's donating and why their sexual orientation of who is donating, because, as I explained before, all blood is screened before use. This quarantine is an example of what would happen if all of us had to follow this ridiculous rule set for gay people when it comes to donating blood, as we have been quarantined for months and the blood supplies keep getting lower and lower, and no one has been able to go and donate blood. This ridiculous system wouldn't allow people to have sexual contact with one another, and is a prime example of what is happening right now with how we are quarantined for months and not able to give blood. This plan would work to the need of blood donations for our healthcare system to run smoothly, and with all the blood already being low, as policymakers would have no choice but to change the law regarding it. Today I talked to everyone listening about an outdated and discriminatory law and why it's an outdated mindset not relevant to our current society, a solution for this law, and how the law negatively affects men who have sex with men. Thank you for listening. Again, my name is Nicholas Seifert.